my face is not the same as her face or the other patient's face. So really catering to what you actually have in front of you, and then providing that component of education so a patient can understand why they have laugh lines.
Welcome to That's Derm Good. I'm Janelle Ball, and I'm excited to bring you thought-provoking conversations about biologics, specialty medications, treatments, and so much more. I'll be chatting with some amazing guests about access, affordability, and advocacy. You're really going to enjoy this show. Welcome to That's Derm Good. Today, my guest is Dr. Heather Prince. Heather is a board-certified family nurse practitioner with a Doctor of Nursing practice, also the founder and owner of Handcrafted Aesthetics and Medical Spa. Thank you, Heather, for joining us.
Thank you so much for having me.
Yes, I love to see other women just starting businesses and thriving in that. But I'd love to hear what your story is and how you even came to start Handcrafted Aesthetics and Medical Spa.
So for a few years, I was a nurse injector for a company out in Newark, Ohio. So before that, I was a patient. I've always loved aesthetics and skincare and anything that can slow down time and keep me looking youthful and plump. I was all for it. So I came in as a patient and would start with facials and then started into Botox and then filler and just things that would keep me looking natural. I didn't want to look like I had anything done or have it where my lips came around the corner before my face did. So there's a lot of things that happen in this business, but mine was always targeted towards something natural. Mm-hmm. So then once I started getting my degrees and I decided that, okay, I want to do an apprenticeship with someone for 2 years. So I did with an oral facial surgeon out in Newark for 2 years and learned just side by side, him and I, which was completely priceless. It's very hard to find anything like that nowadays where you can sit side by side with someone and see different aged faces. Mm-hmm. The perfect patient is that 20-year-old, 25-year-old that has no wrinkles and no lines and everything is tight and right, but having that broad span of patients that are maybe in their 60s or 70s and maybe those that weren't candidates for facelifts or to be put under to have procedures done. So it was just a labor of love, and I love what I do and the chance that I get to change someone's life, because it's just not always about that outer appearance. It's that psychological inner component too that's huge when it comes to aesthetics. It's just not what you see.
So what was that? What led you to that transition? I mean, how long were you in family medicine and what made you decide, I want to do this full time?
So I do both. I still practice as a family medicine nurse practitioner, and then I also have my own aesthetic practice. So it's a labor, like I said, is just balancing those two areas. Mm-hmm. Yes. Because you don't want to lose the skills of the one. And then two, we're still at the end of it, we're still assessing. So is there something on the skin where they need to see dermatology, or is there a concern for your thyroid because I'm assessing your neck for wrinkles? So it still kind of stays in that same circle.
So that training that you had with the surgeon, how did that shape your skills as an injector and kind of balancing the different ages?
It was great to sit and see the way that the face ages. They talk about that triangle of aging, fat pads. So you learn a lot of anatomy, which is really helpful, because then you're understanding, well, what's causing the creases or what's causing the shadowing or what's causing the jowls. So there was a lot of background education that sometimes you don't get when you're not spending one-on-one, and that everything is not cookie cutter. My face is not the same as her face or the other patient's face. So really catering to what you actually have in front of you, and then providing that component of education so a patient can understand why they have laugh lines. It's coming from the cheek falling. It's calling from the fat pad. Why does the left side of my face look worse? It's the driver's side. It's sun every day. I've been driving in the car. So all of those things come together and you're like, okay, now I understand what's going on with my face.
Yeah, I think those are lots of questions that women probably have as you're aging. So how do you explain that to them and help them understand the techniques and how that works?
So there's a lot of education given on the structure of your face. Do you have the capacity to take 2 or 3 syringes? You might not. Your face is smaller, so you have a half. there's also that component of what can we do to enhance the things that are bothering you, but then also not make it where it's obvious. You want people to say like, wow, I look great. I look well rested. Not, oh my goodness, what did you have done? So it's that fine balance of just explaining to what anatomy do you have to put certain products in you. And then some products are not a good choice for you. You're just not a good candidate. Your skin is very maybe saggy, laxy, something along those lines, or you have a very small lip. So I can't give you a Kim Kardashian lip because you just don't have the skin and the capacity to have that. So it's a lot of education, just trying to explain what's going on with your particular face and what we're able to do to help you achieve those natural results.
So what do you do when you have a patient that is just insistent on something that you don't think would look right on them?
I don't do it. I want to be able to sleep at night. I don't want anyone going around and saying, Heather did that. No. So there's a lot of times where you just have to say, unfortunately, we are not on the same page. I'm sure there's providers out there that maybe don't want to have those conversations because they're more inclined to take the revenue versus at the end of the day, I want to be able to sleep at night. I want to know that I did the best with what I was given and that we were able to compromise and achieve what you're looking for.
I guess that goes a lot into the education side and saying, hey, the reason why I don't think that this is a good option for you is because of XYZ, but here is another option or something like that.
Yes. Option A and option B. Yes.
Well, it's funny because you see, what is that show where they're like fixing all of
the watch.
Yes.
Yes. I watched that show too, because I'm just so amazed that a lot of people, it came down to just taking their money and not really looking at the person as a whole and saying that this just isn't going to be a good fit, or it's just not able to make you look like someone you saw on Instagram or TikTok or things of that nature. We want you to look like you, but at your best.
Right. Do you think there's a psychological side of that to where they feel like they have to continue to get fillers and Botox just because they don't feel secure about themselves?
I think there's definitely sometimes a psychological component when you look at someone when they're like, oh, I went here and they gave me 3 syringes, and then they tell you, but they wouldn't see me anymore and put any more in. So then I went to somewhere else. And then you kind of have to back up a little bit with things and say, what are we working on inside? What is our goal? What are we trying to achieve? And then, like I said, having that frank conversation with them, because a lot of times no one likes no. No one wants to hear that they can't have this right here, right then. We're definitely an instant society of gratification. And then sometimes you can convince them to dissolve it and start over and then add to things. There's a process. Sometimes it might take 6 months or a year to get the volume that you're looking for. So it's just, like I said, just bringing things back to the basics, trying to explain to them the best of your ability why you don't feel comfortable doing something.
So you said that it's dissolvable. Is it just the fillers that are dissolvable, or can you reverse Botox that's been done improperly?
So the thing is, if it's a hyaluronic acid that is put into the filler, that can be dissolved. Botox is metabolized by the body. So if you try it and you truly don't like it, your body will metabolize it and break it down on its own. So it doesn't stay indefinitely. So I might get 3 months out of mine, but someone that has a higher metabolism maybe gets a month or 2, and someone with a slower metabolism, it might take 6 months for those effects to wear off. But once the Botox is worn off, it's done. So if you never want to try it again, or you weren't pleased with the results that you had from a particular injector, it's not permanent.
So it doesn't get better over time. I've heard that, it's good to do preventative Botox. Does that actually work? Is that a thing?
So there's so many mixed reviews about that, because you have to think about the wrinkles are like a piece of paper. If I keep folding and folding and folding and making these wrinkles, I'm going to have a permanent line that's there. If I inject something at a lower dose that can slow that creasing, you can do preventative, but you definitely just want to make sure that the dosing is accurate to the type of movement that you have at the time. So you wouldn't want to put in 60 units in someone that maybe is 20 and has 1 or 2 wrinkles, and you would maybe put 20 in just to kind of baby dose them and see. But there's so many things we can do to help prevent. So there's lots of discussions about that. Like, do you wait till the wrinkles come and then you get Botox, or do you start them early? It's mixed. When I was in my 20s, I couldn't afford this. But 20-year-olds now, will finance, put it on a credit card, ask mom or dad, and they're having procedures I didn't get until my 30s and 40s.
What do you say to these younger people that are trying to get Botox and fillers and things like that?
So the education, like we just talked about, you have to have something going on for us to be able to accommodate putting the fillers in. So if it's a thin upper lip, obviously we can't, like I said, go from 0 to 100 in one session. Is it something that we do over 6 months to a year? So they're, like I said, it's just more of the education. And then they'll bring in a photo of someone that their facial structure is nothing like them. There's nothing I can magically do to make you look like this particular person. So what areas of concerns do you have that we can address? I mean, most people really suggest that between the Botox and lip fillers, that's kind of about what you do in your 20s. Maybe a little bit of the chin if a chin doesn't exist, or a jawline. But you wouldn't do tons of filler and you wouldn't do tons of Botox for someone in their 20s.
Right. You kind of mentioned the Kardashians, and we see like the Kylie Jenner with the lip kits and all of those. Do you still see that as a huge trend, or do you feel like a lot of people are kind of moving away from that?
I feel like there's a mix. It just depends on that age and demographic. There's still a lot of young women that come in and have those type of images from Ariana Grande, or, someone that's popular at this time. And the goal is like to work with what you have and educate them on what you're able to do. Some of it is good and bad because we have access to so many things: Instagram, Facebook, TikTok, things that you usually flip through a magazine and like cut things out and have your memory board. But now it's like every day someone's getting something done, and it's instant and it's live. And then we get questions or have consultations about them.
What advice would you give to someone that's nervous about trying injectables?
I think it's fantastic. You have one life and one face. That's kind of my motto. So if there's something that we can do that's going to enhance the outer and inner beauty in you, and it's within your budget and affordable, I feel like you should try it. And like I said, there's things that wear off, and then there's things that can be reversed if you truly don't like those results.
So do you think that there's a lot of misconceptions about aesthetic treatments, just in general, for women that are wanting to do that, but then they're afraid of what others might say? Like, oh, I can't believe you're getting injectables, or you get Botox. What do you do that for?
There's so many people that don't talk about it.
Yeah.
There's so many people that get things done, or they come in and, they want to know what's going to show on the credit card statement. Is the husband going to know? Is the wife going to know? Are people going to be able to look at me and know that something has been done? And we try to explain that so many people get procedures done, but they don't share and they don't talk about it with each other. So it makes it have this stigma attached to it. But about every 2 to 3 people probably have had something done within their lifetime, but just chose not to share it.
I feel like that's true. Even growing up in my age, when I was hanging out with friends, like nobody really talked about it. But when I was in dermatology, we were all about like, hey, yeah, I'm getting my Botox today. I got to refill.
Is there any Botox left over? I could use a touch up here or there.
Right. I never really got into it until I worked in a derm office, and I was like, this is amazing.
Yes.
Why have I not done this?
Yes. And then when I tell people my age and they're like, what have you have done? And I'm like, I talk about all these procedures and all these pharmaceutical skincare products and things that are out there. And they're like, you look natural. I said, it can be achieved with the right direction and the right provider.
And you're right. I think a lot of times there is that misconception of if you get Botox, you're just going to be frozen. And you're going to look like you've had something done.
Yes,
if
you can't blink, you can't do anything. No one knows if you're happy or if you're sad, or if you're awake or sleep with your eyes closed. Yes. And that was kind of like that Joan River era. Everyone thought everything had to be pulled back and you were just in constant shock looking. And that's really not the case anymore. We've come such a long way to make things look very natural.
So I've seen there's a difference between Botox and what are some of the other brands?
Jeuveau, Dysport, and Botox.
Okay.
And they're all, so that's the thing. It's like some of them are like Coke, Pepsi, and Sam's Club Cola. They're all neurotoxins that do the same thing, but you have Botox as the Cadillac, the leader, the one that kind of paved the way for some of these others to come.
So it would just depend on price points.
Yes.
And
so price point and longevity.
Okay.
So you're going to have those two components. I personally only like to carry Allergan products. They've
Mm-hmm.
been around the longest. They've got the studies, the testing behind them. Some places will carry Dysport, and they'll carry like Restylane line, and they'll carry Allergan line. So it just really is more practice specific on
Mm-hmm.
what you want to carry. So there's kind of a menu that you can kind of check on the areas of that you have a concern with.
Mm-hmm.
And that's done like when you come in and fill out your new patient information. Then I usually take that, and then we'll talk about mainly what brings people in is the one thing that they focused on that bothers them the most.
Mm-hmm.
So if it's this laugh line here that's crease, or the 11s in the middle, something you've started looking at and obsessing with, that's the first step, is that you want to fix that area.
Yeah.
So then usually when we talk to the patient, we find out, what's their area of concern today. And then we take a look at that menu and figure out other areas that might be bothering them, like I said, to complement or to explain why you have this laugh line is actually coming from the cheek. It's not the line itself by the nose. So that's kind of how we break down, where do we want to start, what is bothering the patient the most, that they're most concerned with, and then go from there.
So when it comes to, I know you talked about mostly in like your 20s, 25, you're looking at like your fillers and Botox. What are some things that you're seeing for women in their 30s and 40s? And is that different from your 50s and 60s? Yeah.
So I feel like for a lot of patients that are around my age in their 50s, they might have had a lot of sun damage, because back in 74, there was not a lot of discussion about sunscreen. We put on our baby oil, we took our aluminum foil, we went outside and had a great time and didn't think anything of it. So now what we're noticing is also anything that wasn't taken care of from the neck down. So maybe we put our face cream on, but we never carried it to our chest, our neck, and our hands. So then sometimes there's a lot of that. My hands look older than my face, or my neck looks older. So it's really having those conversations about, what can we do about those areas? And then the education, we're taught when we were younger, we washed our face and went down. Everything should have been up. Everything we did should have been up. And like I said, carried from the chest all the way up. So it's different at that particular point in our lives, because we're looking at elasticity and fine lines and age spots, sunspots. So that would be a little bit different, and probably a little bit more of a progression, because there's lots of areas and layers that we have to take care of. The other thing is trying to explain to patients that you just don't want to come in and have Botox and filler injected in your face and not take care of your skin. So many people are using a Dove bar soap for the last 40 years, washing their face at night with no moisturizer, no tone, all of those things. So it's trying to get that other education component, is you've got to take care of the outside and the skin that you have as well. So there's a lot of different factors with the aging skin.
So outside of the fillers and things, are there other procedures that you offer in your practice?
Yes, so we do microneedling. I love microneedling. That just initial impact to get those cells to send collagen and elasticity to that particular area is a game changer. You can do that on the neck, you can do that on the face, you can do it on the abdomen. There's so many different areas that you're able to do the microneedling on.
Wow, I didn't realize that there was multiple areas outside of the face and neck.
And there's some people that do above their knees, because they've got that skin that's kind of sagging and hanging over their knees as they age. So yes, there are other spots that you're able to do the microneedling.
Oh, wow. And so it just regenerates the skin cells.
So it sends we're doing that damage with that injecting of those little prongs on that microneedling that tells the body, okay, there's been an injury to that site. Let's send collagen elasticity so we can fill that area up.
That's interesting. I didn't know that.
Yes.
Oh,
and that's another like minimally invasive. There's not a lot of downtime with it. You don't have to take days and days off of work or anything like that. Yeah.
So if somebody is still dealing with acne, can they still do microneedling, or do you have to treat the acne first?
Is it active acne or like acne? So it's great for acne scars.
Okay.
So if you've had some scarring, so we definitely always recommend to have the skin taking care of itself first. That way you don't have any open sores, infection, anything like that going on. And then get yourself in a nice routine where that acne is under control. And then you can look at microneedling for fine line wrinkles or acne scars.
So the acne scars, meaning like the divots.
The deep pitting. Yeah.
And how many sessions would you say something like that would take if you're trying to get rid of those acne scars?
That could be anywhere. Usually usually we do 3 sessions at a time and then do a package of another 3 sessions just to give your body a chance to go ahead and regenerate, fill up those areas with the collagen elasticity, and then reassess you then. So there's not a magical set of numbers. There's definitely a minimum session you should have to see some benefits and results.
Is that per month then, or?
So you would do 3 consecutive ones for 3 months. Yes.
Okay.
Yes.
I didn't realize that you could do the microneedling different areas.
Yes.
That is wild.
So those that have stretch marks, depending on the depth and things on your stomach, you can do microneedling to help that area because you've got collagen elasticity that's no longer there. So you've got some sagging going on from the stretching and then the going back from pregnancy to non-pregnancy.
As far as advancements within the industry, do you feel like you've seen a lot of that, and with your experience training with the surgeon and also even as having your doctor of nursing practice, how does that advanced training influence your approach now?
So there is so much equipment out there too, because you talked about lasers and cool sculpting, and there's so many things that are out there. I personally don't have any equipment besides the microneedling in my particular practice. I know a lot of dermatologists have a lot of like CO2 lasers, resurfacing. So it depends on the degree of what's going on with that person's skin and concerns. And then to figure out, okay, at this point, do we, send you over to dermatology, or do we go the other route with plastic surgery, depending on what needs to be done. But it's such a fascinating field because I feel like every year there's a new device, there's a new machine, there's something out there that can be done to fix X, Y, and Z, and it's only going to increase. It's such a huge billion-dollar business with aesthetics, and everyone is wanting something done at some point, and then the newer the better, that's coming out constantly all the time. So it's definitely staying up to date with some of those changes, making sure that whoever has this type of equipment has had the proper training, that they just didn't go to a 2-day weekend class at the Easton and and now they have a certificate, and now they're just going out there and just lasering anybody and everyone. Yes. So those are my fears with some of it, because most people don't understand with aesthetics, there's not a board. There isn't a board that you take as a nurse practitioner that says I have to have 500 hours or 10,000 patients to be able to inject.
Oh, wow.
So
I didn't know that.
You want to make sure, yes. Once you have your board license for family medicine nurse practitioner, MD, DO, then it's up to you to have training and other courses. That's why I valued the 2 years that I had, because it's very rare that you're able to do that versus someone that takes a weekend course for 2 days, like I said, and gets a certificate and then starts practicing on people. So you really want to know the history of your provider, and then also the history of anyone within that office that has the availability to do these treatments on patients. And I'm sure you saw that with dermatology, where you see people that went somewhere and had maybe a laser that wasn't great for ethnic skin, and they end up with burns and scars and all that. So it's really important to stay up to date, hands-on training the best that you can.
Yeah, absolutely. What are some skincare or aesthetic trends that you're most excited about?
So the PRP, where you're doing your own plasma blood and you're spinning that as a filler, that's really fascinating to me. Anything that you're able to use, anything that comes from your own body that you can inject, that way you don't have to worry about any allergies or concerns. I know they're using it a lot for like orthopedic, for joints, for knees and elbows. They're using it a lot for the scalp, for hair restoration, in addition to other things. So I feel like that's one that's becoming more and more and more in the forefront, that a lot of people are talking about and looking at. It's great.
Yeah. But that's interesting, because I had back surgery a couple of years back. And before I had the back surgery, I was considering doing PRP for my back, which I had a herniated disc. I ended up needing the surgery anyways. But, that I didn't even know that was an option for that. But also, a family member had PRP done for her knees. So, it's amazing how much different things you can use it for. But
yes.
That's exciting, though. I'm seeing a lot more practices incorporating PRP. So that's pretty
The other
cool.
one is Skin Vive, which is that hydration that's done in micro droplets on the face.
Yeah.
And that's done every 6 months, and that's huge. So you think about all the hyaluronic acid products you put on your face. This one goes just right underneath the skin in micro droplets. And it's a hydration, so it's not a filler. And it's not a Botox, and it's not topical, but it gives that great glow because you're just micro dropping that throughout the skin. And that's another great one.
Is that like injections or how does that
Yes,
work?
injections. It's allergan product. It's called Skin Vive.
Wow. I haven't heard of that one.
Yes, it's great. I do my own every 6 months. I love it.
So that's something that you also offer in your
Yes,
practice too? That's
yes, we offer
amazing.
Skin Vive. Yes.
That's so exciting. So what advice do you have for women in the industry wanting to start something?
Definitely network. For me, being injector for 8 years before owning my own business, I had a great rapport with my drug reps. I had great rapport with physicians, picking people's brains, because that's the main thing. There's really not a manual that says, this is how you start your aesthetic business. It's a labor of love. I think the hardest part is probably like the marketing and Instagram and Facebook and TikToks. I never had an Instagram before my aesthetic practice. So it's like navigating and learning those things, all the algorithms, and making sure that you post content that's valid and interesting. And then funding too. Start with your local bank, see what they have for women, minorities, what opportunities are there. Those are probably the biggest lessons I've learned over the year, is making sure that you have a great foundation and a great group of people that are able to assist, because you'll have something that comes up that you didn't even think about. And you could send a quick text to your friend that owns a place and say, hey, am I supposed to have this license, or am I supposed to have this equipment, or am I, just someone to bounce ideas off of too.
Yeah,
I have
absolutely.
quite a few friends that have aesthetic practices. One's in Youngstown, the other one's in California, and we're always chatting with each other, trying to, bounce things off of each other, or what did you have to do to get X, Y, and Z in your facility? So yes, having that network of people is huge.
Was that something that you've always thought about, or did that just happen owning your own business?
If you told the 30-year-old Heather that the 50-year-old Heather would have a business, she would say you're crazy. You've got the wrong person. There's something wrong. Wires are crossed. But I think for me, what it was, I had a baby 18 months ago. And I have an older child that's 28, and then I have 18-year-old twins, and now I have this 18-month-old baby.
Oh, wow.
And it was one of those like, well, yeah, now seems like a great time. Why not go ahead and start looking at properties and figuring out, because I wasn't sure if I was going to stay where I was at. And then unfortunately that provider had passed away. So it was like, okay, now this is my time to kind of venture out on my own. And there was a lot of making a list, pros, cons, and it's one of those like, you're never going to have it all in one row. So now is the time, seize the moment, and you kind of go with the flow. But no, I was never one that woke up and said, I can't wait till, I own my own business or have my name on the door. And then my husband too, he has a lawn and landscaping service that he's had for 19 years. So he's already had his own business for a long time. So there was a lot of things I could kind of talk about with him and bounce off ideas. And then that whole, generational wealth to have for my kids and have something to pass down, you have to own it. It's really the only way you're going to be able to achieve it.
So how do you balance being a mom and being a business owner and being that's a lot.
It's a lot.
What do you do to disconnect and
my self-care?
Take care of yourself. Yeah, your self-care.
I make sure that I try to carve out time for myself. I'm very fortunate that my parents live one street over and they're both retired. They watch him every Sunday from 1 to 8. So I know at least every Sunday I have some time that I can carve out for myself, or go on a date, or meet friends, or go, to a movies, or have drinks or something like that. So just really trying to have that balance. I go to bed early now. I didn't used to go to bed so early. Now I'm in bed about 8, 9 o'clock. So there's some things that...
Maybe that's key. I need to write that down.
I know. And it's hard because you're trying to turn off your mind and you're thinking about, oh my gosh, I didn't do this. I didn't do that. I was supposed to do this. I was supposed to look into that. Prioritizing, making lists. I love lists. That way I can cross it off and feel like I've achieved something. And then, I try to get my facials once a month. I try to take care and get massages and things like that. So we have a nanny, so that helps too. So there's things that are taken off my plate at the house because we have that. So there's some things that help it work. It's definitely takes a village. If it wasn't for my friends and family and things like that, there would be no way that I would be able to do the things I do.
It's so important to take care of yourself, especially when you're balancing a lot.
Yes, yes. And we have a tendency to put ourselves to the side, especially as mothers. We make sure, they have their eye appointment, doctor appointment, dentist, and then we haven't done any of those things for ourselves and we're behind, but everyone else is on track and up to date. Yes.
Right.
But we
Yeah.
have to be there for them. So we have to prioritize and spend some time, relaxing, meditating, stepping away. Sometimes you have to close the office and not be here all the days that you truly are available so you can spend some time for yourself.
So if anyone is in the Columbus, Gahanna area and they would like to schedule an appointment or come talk to you for a consult, how do they get a hold of you?
So we are at www.handcraftedesthetics.com. We are on Instagram under Handcrafted Aesthetics and also Facebook as well. So those are the 3 best places to get in touch with us.
Well, thank you so much for joining me. It was such a pleasure talking with you. And
thank you.
Such fun stuff.
Yes. It's such an exciting world. Who knows in 2045 what we'll have.
Right. So many advancements. I love seeing that and everything that's happening. So definitely staying in touch and following you to see what's new and what's happening. But it was such a pleasure talking to you, and I appreciate taking the time out to chat with me.
Thank you so much.
Thanks for spending a few minutes with me and listening to That's Derm Good. You can expect new episodes of That's Derm Good every week. The podcast is available on your favorite app, including where you're listening right now. Subscribe to the podcast so you never miss a new episode. Bye.